This video is reviewing the bony anatomy of the spine, starting with the entire spine, and then we'll look at individual vertebrae. So the first thing we'll look at is the cervical spine, which has 7 vertebrae. So starting at the top, we have C1, C2, 3, 4, 5, 6, and 7. Here we have C1, C2, C3, 4, 5, 6, and 7. And then we see the same thing on our vertebral bodies, C1, 2, 3, 4, 5, 6, and 7. Looking next at the thoracic spine, which has 12 vertebrae, we have T1, T2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Here we have T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. And then on our image on the left, we have T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. The lumbar spine has 5 vertebrae. We have lumbar vertebra number 1, L2, 3, 4, and 5. Here we see L1, 2, 3, 4, and 5, and L1, 2, 3, 4, and 5. The curvature of both the thoracic spine and the lumbar spine curves in the anterior direction or towards the anterior side, and we call these curves lordotic curves. In the thoracic spine, which curves towards the posterior side, we call this a kyphotic curve. We also have some important joints to note. The joint between C1 and C2 is called our Atlanto-Occipital Joint. We name it this because our C1 is termed our atlas, and our C2 is termed our axis. And again, this joint is where 50% of the rotation in the cervical spine comes from. Another joint that's worthy of mentioning is the joint on top of our atlas, where it articulates with the skull, and we call this our Atlanto-Occipital Joint. At the base of the spine, where our lumbar vertebrae articulate with our sacrum, we have our lumbosacral joint. Now our sacrum and our coccyx are made up of fused vertebrae. So our sacrum is made up of 5 fused vertebrae, and our coccyx is made up of 4 fused vertebrae. So here we have our 3 types of vertebra. Starting with our vertebra on the left, we have our cervical. In the middle, we have our thoracic and our lumbar. So we have a few key differences that we can use to tell these apart. The first thing being the size of the body. So as we progress lower in the spine, the size of the body increases. Okay. We can also look at the size of the vertebral foramen in the middle. Okay, and it starts to decrease in size as we move down through the vertebra. Our cervical vertebra is what we call a bifid spinous process, meaning that it has 2 points on it, while our thoracic and lumbar each only have 1 point on their spinous process. The transverse processes of the cervical spine are smaller, and again they're bifid, while the transverse processes of our thoracic spine are more rounded on the ends, and our lumbar spine are more narrow and pointed. We have some similarities on each of the vertebrae. The first similarity being articular facets. So these are 2 surfaces that make up our facet joints, which are the joints where our vertebrae sit together or they touch. So on each of these, we have superior articular facets that are showing. We also have some other facets that we'll talk about in a minute. We have a body on each of our vertebrae, and this is where our intervertebral discs will sit. We have our vertebral foramen, which is where the spinal cord will run. We have a spinous process on each of them. The spinous process, again, on our cervical vertebra is bifid, meaning that it has 2 points, while the others are just singular. Each of them has a transverse process. See here on the lumbar spine and here on our cervical spine. The area between our transverse process and our spinous process is called our lamina, which we see on each of the vertebrae as well. And then the area between the body and the transverse process is called the pedicle, which we see here as well. Some things that are unique to each of the vertebrae include the transverse foramen, on the cervical vertebra, and that's where our spinal nerve roots will run. On the transverse foramen, we have costal facets that we can see on the transverse process, and we call that our transverse costal facet. And then we have a second costal facet that is right here that's a little more difficult to see, and then we would call that our superior costal facet. Those are the 2 places where our ribs will articulate with the thoracic spine. Looking again at the 3 types of vertebrae, at the top we have our cervical, which we can identify by the bifid spinous process. We have our thoracic and our lumbar. Some other differentiations that we can make between the 2 are the angle of the spinous processes. So when we look at the cervical spine, we're looking about a 30-degree angle between 90 degrees in our spinous process. When we look at the thoracic spine, we have a much greater angle, approximately 50 degrees. And then when we look at our lumbar spine, our spinous process is changed to be more square-like and less kind of pointed like we would see in our thoracic spine. In between each of our vertebrae, we would have an intervertebral disc. That's almost like the Oreo, remember? So it's more rigid on the top and the bottom, and it's filled with a liquid type material that can move around as we go through flexion and extension. And we would see that in between each of our sections of the spine. So beginning with our cervical vertebra, again we have the body of the vertebra and our spinous process. Which we see here is that bifid process again. On the top view, we have our superior articular facets, which we would also see on the top portion of this vertebra as well as this one. The bottom facet that articulates with that top portion is the inferior articular facet, we also see here. When we look at our transverse process, we also have a transverse foramen, within the transverse process. The area between the transverse process or the superior articular facet and the spinous process is called the lamina. And then we have our vertebral foramen through the middle, where the spinal column would sit. Looking down at our thoracic vertebra, again we have the body. This is where our intervertebral disc would sit. On the top portion, we have our superior articular facet, which we can also see here. And then we have a second set of facet joints on the thoracic spine where the ribs would articulate. So here on the transverse process, we have our transverse costal facet. And then here we have our superior costal facet. And again, this is where our ribs articulate with our thoracic spine. And we see here again that transverse costal facet and then our superior costal facet. Here's our body again. And then between the transverse process and the body, we have the area called the pedicle. And then between the transverse process and the spinous process, we have the lamina. Looking at the lumbar spine, again we see our body. You can also see here. We have our spinous process, again that's a lot more square on our lumbar spine. We have our superior articular facet, that's kind of on an angle, and then here on the bottom we would have our inferior articular facet. We have our transverse process coming off the side. See our spinous process from the top. Okay, just like we saw in our other two vertebrae, we still have that vertebral foramen, as well as the pedicle and the lamina. The pedicle again is between the body and the transverse process, and the lamina is between the transverse process and the spinous process. This is the articulation between C1 and C2, and again we call that the Atlanto-Occipital Joint. Now on the top of our C1, we see these two large articular surfaces. This is where the skull will articulate with our C1, and so we call this either the superior articular facet or the occipital articular facet. Again, we saw our transverse processes, and that one is on C1, and then we also have the transverse process on C2. We have the spinous process that's only present on C2. On C1, we have a posterior arch and an anterior arch on either side of our vertebral foramen. In our transverse processes, we also have our transverse foramen, for our spinal nerve roots. The prominence that comes up off of C2 for our C1 to articulate around is called the dens. And we can see it there. And our dens is surrounded by a ligament that essentially holds it in place against the anterior side of the C1 and allows rotation of the C1 around the C2. Again, keeping in mind that this is where 50% of the rotation of the cervical spine comes from. The joint that exists between our superior articular facet or our occipital facet and our occiput is called our Atlanto-Occipital Joint. And that's our only connection between our spine and our skull.